The candidates for November are set.
I know Donald Trump's type.
Between now and Election Day,
we are not going back.
A campaign season unfolding faster.
Kamala Harris is not getting a promotion
Than any in recent history.
Make America great again.
Follow it all with new episodes every weekday on the NPR Politics Podcast.
If you've tried to schedule a doctor's appointment recently, especially with any sort of specialist, you've probably had to plan out weeks or even months in advance. It's a struggle to get an appointment, so what happens when you get one and then just don't show up? Collin Schopp from sister station WCBU reports in this edition of WGLT's Sound Health.
Some hospital systems level a fine on no-show patients of $100 or more. After all, the 2023 study shows a no-show costs medical professionals an average of $200. But even as other studies show these rates rising, some are questioning how effective the fees are.
At the end of the day, it further contributes to really some of the issues that we see in regards to lack of adherence of care plans, and it doesn't really allow the patient to get the access that they need, especially if we have patients that are already financially constrained.
That's Amanda Mishler, Senior Vice President of Clinical Operations for OSF Medical Group. Mishler estimates that OSF fluctuates between a 20 to 30% no-show rate across all specialties. However, she says the Peoria-based hospital system has never charged a fee for no-shows, though the reasons for that over the years have changed.
I think what has changed over the years is our ability to be able to know more about our patients, specifically within that social determinant, social driver aspect.
When Mishler says social determinants, she's talking about things like transportation, food, finances, and education. They're the things where having access or lacking it changes the way we move through the world.
As an example, medication cost is certainly a financial impact to many patients that we see. And so we do have alternate options where we can offer generic options within medications and or vouchers to help patients be able to pay for some of their medications. But without us having that insight and really knowing our patients from the social aspect, it really inhibits our ability to be able to care for them differently.
In order to know more about the social aspects of patients, Mishler says a survey collects data on these points when they go through the new patient process. This also can include a new patient agreement, where the patient has to buy in and make a commitment to show up.
If we do end up continuing to see a lack of adherence to showing up to appointments, we will administer some other policies, which actually kind of puts them back into a new patient waiting pool, if you will.
This accomplishes a couple of things. One, it opens up future appointments the chronically absent patient may have had scheduled for others on a wait list for openings. Two, it encourages the patient to re-up their commitment to showing up without impacting them financially.
Giving them a fine for not showing up to an appointment is not going to help them on their healthcare journey. It's going to further impact their healthcare.
One of the scenarios Mishler describes that sometimes results in a no-show is someone being admitted to the hospital in an emergency, then not understanding that they require follow-up care after they're released.
Sometimes it's just purely a lack of education and understanding on the patient side about the criticality of the importance of those appointments, and really that we're there to help support them as they transition maybe from an inpatient to an ambulatory setting.
Worst case scenario, that patient's condition worsens and they end up back in the emergency room, requiring care more expensive than the preventative measures that would have been taken during their appointments. That, Mishler says, increases the cost of health care for everyone. Skipping the fees on no-shows isn't necessarily a rare practice in Central Illinois. In a statement, a spokesperson of Carle Health told WCBU that their hospital system doesn't impose fines either. But no-shows are still a problem, and Mishler says the solution will take work.
I just think the general education to the community, to our existing patients, as well as maybe the healthcare consumer in general, really the philosophy at OSF, and really the opportunity to educate the general population in regards to the impact that it has.
In the meantime, Mishler says OSF uses features like reminder texts and calls and the OSF MyChart app to try and keep patients on top of their medical schedule. I'm Collin Schopp.
Support for WGLT health coverage comes from Carle Health. You can count on Carle as your partner in healthcare. Information at carle.org.
The candidates for November are set.
I know Donald Trump's type.
Between now and Election Day,
We are not going back.
a campaign season unfolding faster
Kamala Harris is not getting a promotion.
than any in recent history.
Make America great again.
Follow it all with new episodes every weekday on the NPR Politics Podcast.